All right. Hello, everyone, and welcome to today's virtual panel discussion brought to you by Georgia Association of Healthcare Executives. My name is Vishwa, and I'm your session host representing the National Office of the American College of Healthcare Executives. We are so glad you're here, but before we get started, I want to go over a few housekeeping items to help you navigate the virtual environment. For the purpose of noise control, your lines will be muted for the duration of the session. The chat function will be available to you throughout the entire event. The event is being recorded and will be available for viewing in approximately 2 business days in the LMS system. Today's session is worth 1.5 hours of ACHE face-to-face credit. To earn this credit, you must be logged in for the entirety of the event. We do encourage you to complete the evaluation for this event. The link will be in the chat as soon as I finish speaking. Now to begin the event, let me turn it over to Trent.
Thank you so much, Vishwa, and welcome everyone. We're excited to have you here today. As always, a really on-point topic, and one that unfortunately over these past 2 years of the COVID pandemic, we've had to make a lot of decisions inside the walls of our hospitals. And so we're really privileged to have some of the foremost experts within Georgia and across the country here with us today to talk about ethical challenges that we've had to make as healthcare leaders. So welcome to our panel. Excited to get them introduced here in a moment. That said, today is a annual meeting, which there are some items that we need to go through first. Obviously, we'd love to be having this in person, but still under the virtual platform, at least for the remainder of this year. So thank you for taking your time today. Love to start, obviously, first and foremost with recognizing our sponsors. We don't put on events like this without amazing sponsorship. And first and foremost, our platinum sponsor, Wellstar. Not only do they provide us with a lot of great talent within our board and within our committees, but they also provide our platinum sponsorship. Gold sponsors, Piedmont Healthcare, Metro Atlanta Ambulance Service, Vocera, and Sound Physicians. Thank you all. And our silver sponsors, DT Spade and SSR. Again, great to see so much engagement, and appreciate you helping us put amazing events like this on. 2021, again, what a year. Certainly one that we thought we were kind of through the weeds and the most of COVID in 2020, but 2021 presented a whole new host of challenges and several other waves of COVID. In that, really proud to just see how our organization with Georgia Association of Healthcare Executives really fought hard to fulfill our mission. I tell you what, that we are chock full of amazing leaders, again, that serve on our board of directors, as well as serve in a volunteer format across our committees. And we are unable to achieve results like this if it wasn't for just amazing leadership and volunteer leadership in that. So you can see here just just tremendous work having face-to-face credits. GAHE was out of the gate early with our work with ACHE to offer face-to-face credits, and you can see there we had 13.5 hours offered to our membership in 2021. 20 webinars that included Clubhouse programs as well, and those were 20 hours of qualified credits. So again, a tremendous offering. And then we had our Board of Governor exam. It's an annual event. Really proud that we had 19.5 qualified hours as part of that program. I can tell you, I have a mentee of mine who took that course and she passed her exam just yesterday. So we're really excited about that. And then our membership growth, 236 new members. Really amazing to look at our roster and see the growth that we've had even in the midst of a COVID year and on this virtual platform. Over 1,500 members on our roster today. And then our fellowship advancement again, I'll put a plug out to Katie Hedge, who passed her exam just yesterday. Really proud of her, but 13 new fellows, that'll be 14 now with Katie added to the list. Really proud of that group. And then recertified fellows. Actually, I just recertified myself. I haven't got a copy. I'm really proud to see her engaged. Yeah, next slide there. Thank you. Yeah, and so just really, really great work. Now we want to transition into our 2022 Board of Directors slate. I will say it's been a privilege and honor being our first 2 year GAHE president. I tell you what, we've had an amazing board who has been engaged over these past 2 years of navigating us through really the most challenging time in our existence as a chapter. But I'm really excited to present, and here on the screen you'll see the slate for 2022. And this point in time, we're actually going to pause. Vishwa is going to help us to put together a yes or no proposal to our membership. So just take a moment with us, please. And if you accept the slate in front of you, please answer yes. And if you oppose, please answer no. And we'll take a couple minutes to wait for y'all to tally up the results here. All right, and I'll wait for Vishwa to let me know if we're good to move forward or not. I'm sure she's tabulating as we speak.
Trent, I think we're good. I captured it. It looks like we have 46 in favor, none opposed.
Well, there we go. Perfect. Perfect. Well, that's fantastic. So welcome to our new slate, and I'll introduce those folks here in one moment. Also want to just take a minute to recognize other individuals in the organization who have continue to play and have played a big part. Well, here we go. Perfect. All right. Let me introduce the slate. Really excited again to introduce this group. John Keevan, our new president. Congratulations, John. Angela Henry, our vice president. John Paul Kroom, our secretary. Sharon Oiken, our new treasurer. Welcome, Sharon. Excited to have you as part of the team. And myself as the past president. And then our regent for Georgia, Callie Andrews. Congratulations, Callie, for all the work that you're doing. Board member at large for our communications chair is Seppi Browning. Congratulations, Seppi. Our other board member at large and new programs committee chair, Nicole Denham. Congrats, Nicole. Board member at large and fellow advancement committee chair, Rahul Goti. And our board member at large and diversity and inclusion chair, Jarvis Gray. Board member at large and membership growth and satisfaction committee chair, Doug Gregory. Board member at large and physician executive group committee chair, Boykin Robinson. And our board member at large and sponsorship chair, Bobby Ryan. Scholarship subcommittee chair, Chet Basin. Joint programs subcommittee chair, Bryant Cornett. And career development subcommittee chair, Graham Fox. And our advisors, this group of senior advisors provide us a lot of support. Jay Denard over at my CEO colleague at Northside Duluth, and Larry Tyler, also an advisor, as well as our webinar subcommittee chair. So welcome and thank you for all y'all's continued support. So congratulations to the new slate, and for the new ones that have just joined us in leadership roles, congratulations. I also want to take a moment here to recognize those that have stepped up in a big way for our program. Every year, ACHE provides recognition to healthcare management excellence and volunteer service to our chapter. And I'm really excited to present our winners this year. Ty Boskert, Ann Brown, Mary Gurman, John Keevan, and Bobby Ryan. Congratulations, virtual round of applause to our ACHE Recognition Service Award winners this year.
Trent, I'm gonna steal the mic from you here for a minute, and really proud that I get the honor of presenting you with the outgoing president's service appreciation plaque. And as Trent mentioned before, one of the great things about GAHE is the networking and getting to know other people and learn from them in the industry. Trent, it's been an honor to get to work with you for the last 2 years. As you served as president, I can't think of someone that could have handled a pandemic and the challenges we faced with so much poise and kept us going and not just surviving, but thriving as a chapter. You've done just an amazing job. So I've really enjoyed getting to know you, and it's my pleasure to present this plaque that recognizes your outstanding leadership as a two-term president. So you get both 2020 and 2021 on it. And we can't thank you enough for your dedication, support, and leadership over these past 2 years. I think the whole GAHE chapter is indebted to you while doing a full-time job and leading a hospital through a pandemic. So thank you, Trent, for all you've done for us, and certainly an honor to provide you with this.
Well, thank you, John. And for those that don't know, John agreed to serve 2 terms as well.
Trent's funny. Funny.
Thanks, John.
All right, Trent, I'm turning it back over to you, bud.
All right, appreciate it. All right, and then always we love to share our upcoming GAHE virtual meeting events that are on the horizon. December 8th, we've got GAHE Undercover. We've really gone deep into this clubhouse model, and it's really been received with a lot of accolades. But we've got Jay Denner is with us as he talks through what the leadership checklist, what you should do in 2022. So looking forward to learn from Jay. And then we've got certainly face-to-face credits, which will be coming up in January. More to come there on the details of that registration. And then certainly mark your calendar for February 17th, where there'll be more ability to access face-to-face credits. And certainly as we look forward, we'll remain in a virtual state, but as things evolve, we may be able to return to in-person at some point in time. And all these events can be registered for at gahe.org. Stay connected. Again, these platforms are the ways that you can stay connected with all that we're doing. You can see here through our website, through Facebook, LinkedIn, GAHE Connect on our Twitter. And, again, Stephanie Browning does a great job of leading all our communication efforts. And then get involved. We don't do this without amazing volunteers. This is all volunteer effort that makes this program work and this organization run. And you can see the various committees. So if you have an interest, please reach out to Bruce at admin@gahe.org. And today's session worth 1.5 hours of face-to-face credits, and you will actually add those credits, or will be added those credits into your record. Allow 4 to 6 weeks to have that take place, but you'll see that on your list here soon. All right, without further ado, great topic today. Again, one that has been a challenge for all of us in leadership seats throughout the pandemic and ongoing. And our moderator, Jason Lesadrini, will lead a great panel of experts across our amazing state of Georgia, which we're fortunate to have fantastic leadership in this community of Georgia, and really assets that we can learn from today. A little bit about Jason before I turn the mic over to him. He is the AVP advanced care planning and spiritual health within the Wellstar Development Center. And you can see a bit about Jason's role. He's been in that role since 2018, February 2018. He provides leadership and resources to promote ethical behavior and decision-making aligned with the mission, vision, and values of his health system. He is focused on building capacity through ethical decision-making and development of health system staff. Jason, I know you've been a very busy man these last 20 plus months, and we're really looking forward to hearing your story, but hearing the story from the colleagues on the panel today as well. So Jason, take it away.
Well, thanks, Trent. I really appreciate it. Thanks, everybody, for your time and attendance today. Just give me a second to do a little quick technical switch to the slide deck that I'm going to run here. All right. Of course, it's not allowing me to switch the mode. All right, well, Bruce, it's not allowing the shift anymore. Can you all see the slides?
Yes.
Yes.
Okay. All right, well, we'll go with this. Technical feats aside, we've had plenty of these in our life. So Trent, again, thank you very much. I want to thank everybody in the room, but also thank our panelists today. And I want to do a quick introduction of the group as you see before you. So I'm honored to be up here with them and leading them through sort of a really intimate dialogue, and look for your feedback and questions and comments as we sort of move forward. So let me start off by introducing Carol Babcock, who's the Director of Palliative Care and Healthy Communities at Atrium Health Navicent. I have known Carol for a very long time. I consider her a very close friend. We've known each other in the ethics community and world for some time now. So very honored that she's here with us. Bruce Greenfield is a professor, as you can see, in the Division of Physical Therapy in the Department of Rehab Medicine, Emory School of Medicine. He's also a senior fellow at the Emory Ethics Center. He has a master's in bioethics from Loyola, and he's taught and worked in ethics for a number of years and brings a great wealth of knowledge. And then last but not least, I would be remiss if I didn't introduce Jessica Ginsburg, or Jessie as she's known to me, who is a clinical ethicist here at Wellstar Health System. Her background is in law, and whoops, sorry, 1 second. Why is it doing it? Her background is in law. There we go. Sorry, my apologies, group. Her background's in law and works with me at Wellstar Health System in our clinical ethics program. So I'm going to give a quick overview, a little conversation starter for the group. And for those of you who have been with GAHE for a while, you will know that I presented a number of years ago on ethical leadership to the GAHE group. And we talked at that time and did some assessments and a survey with each other to talk about what really are the components of sort of ethics. Are things often around characters and attributes. And so it's not that I would deny that that's the case, that if in order to be an ethical leader, you need to possess certain characteristics, but it seems like it's more than that. And that's what I was trying to explain to the group when we met 4 years ago for that conversation. What I suggested at that time is that those characteristics make you a moral person. What makes you a moral manager is this behavior that we tend to see from what we ultimately call ethical leaders. And so as you can see on the screen, these are the few characteristics that some pretty good evidence has suggested are requirements for being a moral manager. So you demonstrate ethics as a priority, use the right incentives to drive behavior, you practice ethical decision-making, and you support your local ethics program. And so what happens is we tend to think of these, as you can see the image on my screen to the left, as separate entities. You have this moral person and you have this moral manager. And what we're trying to get to at the end of the day is an ethical leader. So when you add a moral person having certain characteristics, attributes, and you add that to the behaviors of a moral manager, you get an ethical leader. And so what we're going to go do today is really talk about ethical leadership as these combined behaviors, but recognizing, as I said 4 years ago, and will continue to say till I die, that being a leader is hard and being an ethical leader is hard. There are challenges all abound, and we struggle with it just like your dog struggles with it on a daily basis on whether they should pee on the floor or they should go scratch the door. Having a new dog in my household, I'm seeing this more and more. And as Trent rightly pointed out, we've seen ethical leadership being tested more and more during these last 2 years of the pandemic. I would claim that it isn't any less important. In fact, it probably is more important now for us to begin thinking about what we mean by ethical leadership and what practices we can invoke. And so that's what I want to do now is turn to our group, our expert panel, and really get us going in a conversation. So I'm going to start off first with a question for you, Bruce, if you don't mind. Could you give us an example when you saw a leader exhibit either these characters or behaviors or of being an ethical leader?
Yeah, can you hear me okay? First of all, I want to thank Jason and all the other panelists and the participants, and thank you for inviting me to share this with you. I've written out some answers, so you'll see me looking down a lot. So I apologize for that, rather than looking straight at you. So I thought about this question, and these are my thoughts. To answer, what constitutes an ethical leader, I think we need to look towards Aristotle and his normative approach to ethics that really focuses on virtue ethics and the moral characteristics of those who act virtually or embrace virtues. And I'm a member of the Embryosical Ethics Committee, so I've had the opportunity over the years. I've been on the committee for a number of years, and I've had the opportunity to observe fellow members, and all of them exhibit virtuous character traits. However, I've come to believe that virtues alone do not assure ethical behavior, or at least good ethical behavior. And more specifically, virtue is necessary but not sufficient for ethical leadership, and that's my claim. One can be compassionate, for example, which is a virtue, I think, or a value that we all embrace, but also do wrong. Think of a compassionate family member who's a surrogate who elects to continue fetal treatment for a family member who lacks capacity and an advance directive to avoid suffering. So what sets ethical leaders apart, in my opinion, is a combination of virtues, but also practical wisdom, or what Aristotle calls phronesis. It really is a combination of character traits that's balanced with a disposition towards pragmatism. And so if we think about practical wisdom, it's not so much that we think about what we ought to do, but rather what we can do. And it consists, an ethical leader has that unique combination, in my opinion, of virtue characteristics, but also experience and prudence. And that distinguishes between knowledge, ethical knowledge, and the application of that knowledge in a particular context. Members of an ethics committee, ethical leadership, act as moral agents. And it also is important to make a distinction between morality and ethics. I'm not going to do that, but they are different. The members of the committee, the leadership, act as moral agents based on a framework of values to guide ethical decision-making. At the same time, they have the knowledge and foundational skills of applied ethics to make justified ethical decisions, and they're able to navigate within the boundaries of what is possible, often not what is ideal. What ethical leaders are really good at is getting others to buy into compromised decisions. And perhaps the most underappreciated quality that I've observed of an ethical leader.
Bruce, you've muted on us. You've muted on us. That's all right. Yeah. If you can, come back and get, I think I can hear you now. Yeah, keep going on an example that you've seen.
Well, I think what's most underappreciated is the quality of an ethical leader to deal with ambiguity. And as many of you know, ethics, there really is no perfect answer or solution. And in many cases, we don't even know the right answer or course of action. Healthcare is a relational practice. It deals with multiple stakeholders who hold at times different values and make different judgments. An ethical leader is an individual who is able to recognize these differences and the conflicts in moral values and approaches to ethical decision-making and ethical perspectives. And what's most important is they're able to create space for all. They act with intentionality to share up space, empower individuals to articulate their ethical concerns and give voice to all of those who may hold different ethical perspectives. So that's pretty much what I wanted to start with.
Well, thanks, Bruce. I appreciate it. Carol, I'm going to turn to you, if you will. Knowing the experience you've had serving as the chair of the ethics department for a number of years, I'd be curious if you can share with us either an example as yourself, how you were challenged ethically as a leader, or when you saw a leader that was challenged ethically, maybe what made it so difficult, what helped you, if it was you or if it was them, resolve it?
Yeah, there's actually a great example that I have of one thing I've learned in healthcare is you have to be prepared for the possibilities of things that you've never seen in your life. And with that, I think, as Bruce was talking about, there's such gray areas in the law many times, and we're faced with things that we may have to on the fly make some really tough decisions. So a perfect example of that happened not many, but several years ago for us in our organization, where a patient came in and actually was very close to death. And the family members, the wife, first of all, asked if we could help her because she and her husband had planned to have children. Unlike Bruce, I didn't make notes. All I wrote on my piece of paper was sperm. So that's what we're talking about today is what they were asking for is to withdraw reproductive tissue so that it could be saved for a future date to be able to have the patient's baby. Well, in my mind, I thought this is probably the one and only time I will ever deal with something like this. I took it to our administration. I spoke with our doctors. Everyone that was involved had so many different responses to what should be done. And I think that what happens with a lot of ethical situations, and this is one very specific, but if you think about many others, sometimes your first response is emotional. And this particular patient was one of our officers and had been shot on duty. And this really leads to, really a lot of emotional feelings. And I can remember one of our top executives first saying, well, we just got to do whatever we can to help this family because this is a really bad situation. And, we need to do everything we can. And then the doctors were bringing up, well, we don't even know exactly, we would have to get a specialist to come do this. And we do not have one of those in our hospital. And then the other people that had to be involved, of course, was our attorneys. It always seems to me that ethical issues collides with the law. and we have to really sit down, get with our lawyers, sit down and figure out what are the laws around this, and then how do we make decisions. Since there was no precedence, there was nothing in Georgia law that particularly spoke to this. There were things that we had to just make a decision. And to me, when it comes to ethical decision making, doing the right thing is what you aim for. So how we managed this one particular situation was we did a lot of interviews. We really tried to find out what would this patient have wanted for himself. Did he truly want children? How did the parents of the patient feel? Because they would be the grandparents. How does the wife, how would she be able to manage raising a baby on her own? And, there's just a lot of different people had to be involved in this one specific situation. And since once it was all over and decisions were made, a specialist was brought in and things were done to help this family. To me, I felt like, well, okay, we're closed the book and that's something I will never see again. But lesson learned, if you see it once, you'll see it again. We've actually had that same situation with very different kind of issues come about 3 times. So we did have to write a policy. And I think that's where a lot of policies come from. Sometimes you read laws and policies and think, who ever thought of this? Well, it's because something happened along the way. And so a policy was born and we now have that on the book. So that's a very specific situation, but it really pertains to, a lot of ethical decisions having to be made on the fly and just using your real good common sense to do it in a good standardized way and fair process.
Yeah, I think, Carol, what you highlight there too, which is unique for the group that's on this call, is that ethical challenges repeat themselves more often than not. They're not often rarities. Now, a pandemic is usually a rarity, but ethical challenges do confront themselves regularly, and so preparing ourselves as leaders to think through and have some type of framework to think about how might we make a decision should this situation come up in the next time. So, and that's a good good example of what it means to be an ethical leader, is to think through a discernment or decision-making process that could help prevent you from having to sort of rethink it from the beginning, and to ensure that you're being fair and just. So I appreciate that response. Jesse,
can I just jump in make one comment? Or
sure, real quick, Bruce, if you will.
I agree with Carol said, and one other point is that one of the attributes of an ethical leader is to not only experience different things, but reflect on those experiences,
right,
and try to understand the meaning. So I think reflection is a very important component. So if the similar situation arose again, they'd have some sense of what would be the most appropriate thing to do.
Correct. So Jesse, I'd be curious if maybe you could sort of think about it, that same question that Carol did about, thinking about an example where either you were challenged ethically as a leader, or you saw a leader who was challenged ethically, be it during the pandemic, be it pre-pandemic. I know we've been overburdened with pandemic stuff, but you're welcome to give us a sort of your thought and sense on an example where a leader struggled and what they did to get through it.
Sure. So given that I'm kind of relatively early in my career, I will speak to when I saw a leader was challenged ethically and how it was kind of steps taken to kind of help resolve it. I'll be talking about you, Jason, as my leader, and just want to make it clear that the fact that he's the moderator here is not influencing or impacting my response. I would say the same things if he wasn't here. So I'll talk about kind of the pandemic. I think for me, it's most relevant and applicable, and I'll kind of explain why. Obviously, the pandemic kind of presented a ton of ethical challenges, many unprecedented for healthcare leaders across the state, across the country. And I'm sure I'm preaching to the choir here when I say that, because I'm sure many of you all have lived it and are continuing to live it. But I think I have a little bit of a unique perspective on observing kind of Jason sort of face some of these ethical challenges during a global pandemic, because I started in clinical ethics at Wellstar in August of 2019. So I kind of got a taste, about 6 to 7 months, of what things were like, BC, before COVID. But the majority of my time working as a clinical ethicist has been kind of throughout the pandemic. And so over these last 19 months or so, I've observed Jason and other leaders take on some of the most ethically challenging tasks, just given the vast number of unprecedented, multi-layered, multifaceted issues that kind of all arose simultaneously or kind of consecutively as a result of COVID. And I know that ethical leaders in healthcare systems across the state and across the country probably face similar challenges. So I think the observations that I'm about to share are probably widely applicable and span beyond just kind of what I observed at Wellstar. So in the interest of time, I'll just talk about a couple of these sort of layers that I noticed. And I'll highlight ethical challenges kind of at a system level, kind of at a provider level, and then sort of at our department level. So I think at the system level, there were challenges to think about ethical triage practices, ethical allocation practices for scarce and finite resources, both within each individual hospital, but then also across our system. So Jason was a part of a larger group of leaders who were tasked with implementing ethical standards for fair distribution of resources to patients within a particular hospital, but then also had to consider sort of fair treatment by the system and kind of thinking about deciding which hospitals within the system will or will not get additional resources, and sort of how working at a system level, but then kind of like an inter and an intra hospital ethical challenges in dealing with this sort of at a system level. I think at a provider level, as the pandemic progressed, our institution, I think like many others, began to see staff burnout and rising levels of moral distress among doctors, nurses, other providers. And given that one of the hats that Jason wears is AVP of ethics, I think many folks across the system, executives, physicians, administrators, other providers turn to Jason, and I think by extension, the ethics department, to kind of help support providers on the front line beyond our sort of regular ethics consultation service duties. And then third, at kind of the department level, and then Jason's also the AVP of spiritual health and interpretive services and advanced care planning. Our team was faced with new types of ethics or spiritual health or ACP challenges and consults. And so he, as the leader, had to kind of help lead us in thinking through some of these never before seen issues. And so I think what made this, while each of these layers in and of themselves presented their own complex set of ethical challenges, I think what made this so ethically challenging is the fact that they all kind of occurred at the same time. And Jason, as well as other leaders across the system, had to figure out how to manage and juggle the attention and the time spent on these different layers, while many times not knowing what was coming down the pike or what was going to happen next. And so I guess to kind of talk about the second part of the question of how he addressed and resolved these challenges, I think there were several effective approaches that were taken. At the system level, he gathered with the ethics department. We talked about and drafted a crisis standard of care policy. We thought deeply about what just allocation of resources means in a time like this and what it would look like. Communication and collaboration with other healthcare leaders across the country to sort of see how they were thinking about particular issues, and maintaining communication with the VPs of the hospitals. To address the moral distress and the provider burnout, one thing we did was Jason brought in a team of moral distress experts to come and train the ethics service or the ethics department here to kind of learn how to lead a moral distress conversation. And then that's now a new service that we can go out and offer upon request to different groups across the system who may be experiencing, higher rates of moral distress. And then we've continued to kind of think through creative ways, under Jason's leadership, of how to make providers aware that the ethics team is here and available as a resource to them. And then in terms of how he led us at the department, I think at the beginning of the pandemic, he would hold weekly meetings to keep us updated. He was always, and continues to be extremely honest and transparent about the current state of the hospital and health system and sort of what to expect. He's always responsive with reaching out whenever we reach out with a question or a concern, where he's available for us to bounce ideas off him, things like that. And he continues to sort of adapt and lead our department in adapting to the sort of changing realities that the pandemic brings. And so, that's just that's a brief observation. I'm sure there's a billion other, related ethical challenges that I haven't mentioned or don't even know about. But some of those ethical challenges that came across his plate, at least that I observed, and the way he effectively tackled and continues to tackle each challenge as they come, definitely does not go unnoticed by those on the ethics team. So that's my answer.
Well, thank you, Jesse. I'll send your check in the mail, so I appreciate that answer. But what I will say is sort of a response and thinking through that is, I think everyone across the system across the country was stressed by these things. And one thing that often we fail to recognize in ethical leadership is looking to leaders above us. And who can help guide us. And I'm just going to point out too on the call today that they're welcome to place comments in the chat. But John Cuban and Callie Andrews are two people that I know fairly well. They've been willing to share their cell phones with me, and we connect regularly. And I think having role models who exude and exhibit sort of ethical leadership, both in character, both in being a moral person and in a moral manager, make it easier to be one yourself. That when you have good role models, you can model their behavior. We know, and I'm going to leave this to Carol in a second, we know that most people have not developed out their moral model. Right? Like, how would I respond in a particular situation? What most team members are doing is looking to their leader to exhibit that behavior for them. And I will tell you, I've been thankful enough to have wonderful leaders at Wellstar and personal leaders who I've looked to sort of lead the way and model that behavior. So guidance and characteristics. John and Callie have been immensely helpful. So kudos please to John and Callie for their guidance. I will sort of forever be indebted to them. Carol, I think that gets us to an interesting segue here and thinking about leaders and those in the middle, right? So we have leaders who are at the top and we have those who are sort of at the bottom. But I wonder how we get, one suggestion is having role models, and maybe that's what you think is the way to do it that I've suggested, but how do we get sort of ethical leadership to emanate from the middle group of leaders, right? We can do things to the top and maybe it will roll downhill to the bottom, but what do we do, Carol? What do you see as good strategies to getting us to sort of promote ethical leadership in that middle manager space?
Well, since I'm one of those middle managers and middle child, so I'm just the redheaded stepchild, actually. I really think that the best way, I like how the role modeling is, but it goes further than that to me. I feel it's so important to empower people that work up under me, or even at the same level and within committee meetings and everything else, to not always give the answer and to be able to, here's from the ethics committee what we think. I really challenge people to think it through themselves and kind of help mentor them and empower them to think of the what ifs. And I like really being very transparent within my own team. I like how Jess was talking about getting together on a regular basis and keeping them updated. I think that is so important. Healthcare is changing every day now, and there's so much that we just don't understand. And if we're having a hard time at the middle level really grasping it, imagine at the staff level. So I think that that's very important to be not only keeping them updated, but also asking their opinion. I mean, how do we deal with this? Give me some examples of ways you would tackle this. I think we'll be talking about some other issues that come up in the future. And I think this is kind of a really a big place for us to work with those around us to try to systemically think. And how is it going to affect people? How are we managing all the challenges that are coming down from government reimbursement to ways of trying to do things new? As you stated, I'm over healthy communities, which is population health. So there's just so many new avenues to go and ways to be able to reach out and trying to really listen within our team of the diverse responses and getting people's opinions of how will someone feel if we are identifying them as vulnerable. How does that make them feel? And is there a better way for us to come to them and offer services? Or maybe we're not offering services. Maybe we're coming to them and saying, what is it that you need? And so I think being able to truly open the door, and I'm one, since family therapy is my background, I do it with people well above me as well as people below me. And I kind of challenge people to kind of think through those things and really think about the equity of what we're doing and how do we address these new issues with a good systemic way of focusing on it.
Yeah, Carol, I hear that, and I think it leads me to a great question, Bruce, that I'm going to skip to you and ask you, but maybe just make a quick comment first about your remark, Carol. So there are ways that we can be transparent and improve our teams, and I'm going to ask Bruce to maybe elucidate a little further on that. One thing that we often fail to recognize as to be an ethical leader is it is tough, but sometimes it's just simple actions of being straightforward, or even perceptions of ethical leadership can be improved by doing small things. So I'll pick on John again. You know, John and I have talked numerous times about ethical leadership and what it means for team members. And I've worked with folks, both with John and with Callie at their local sites about developing ethical leaders. And one thing that we can do that's just so simple is to talk about the values of our organization and how we're making decisions consistent with those values. And so when we think about middle managers, what can we do with our middle team? It's empowering them with those values to make decisions based on those values. Happens on the top, happens on the bottom. Let's do that. Let's think about the active things that we can do. I think that leads into a question I'd like to ask you, Bruce, about, what do you think leaders could specifically do to facilitate sort of ethical thinking amongst their teams? One strategy that I've suggested is using the values, or there's another one that's even simpler that says something like, ethics is important to me, go team. How does ethics play out here? Because I know that their teams are facing ethical dilemmas. The pandemic has showed us this. The pandemic has showed us that leaders are facing ethical dilemmas. And so, Bruce, maybe give us some insight on how you think leaders can help facilitate ethical thinking amongst their team. You're muted, Bruce. Yep.
Well, first of all, ethical leaders have to be intentional. And what I mean by that is they have to be intentional in terms of talking about ethics, or always bringing up the fact that, these are issues that we need to look through an ethical lens, because ethical is just not some, educational, irrelevant thing, but it's really part of best practice. It's absolutely important to integrate throughout practice in the healthcare system. Ethical leaders can contribute to the ethical culture of an organization, and they can do that, in my opinion, in two ways, formally and informally. So formally, they're going to be working with policymakers or compliance individuals and try to develop, number one, when policies are being developed, to make sure that as these policies, which are rules basically, or laws, are thought through from an ethical lens. Ethical leaders cannot assume people are empowered, and so they have to deliberate in empowering individuals to speak up and include them as much as possible in part of a conversation. And one of the ways they can do that is to create safe spaces. Now, I'll give you an example. We're moving into an era, if we not already moved into that era, of interprofessional collaboration practice, teamwork. And one of my colleagues has wrote a lot about how do you create an ethical interprofessional team. And she developed a concept called carving out a moral commons. And what she means by that is carving out within your interprofessional team a common space, a safe space of shared decision-making, where each member of a team can engage in moral dialogue. And part of that is each member is free to speak up. Because you got to remember that when we're dealing with ethics, we're dealing with really a multidisciplinary situation, different professionals. So in a moral commons, these professionals get together, and some of the questions that are posed and that they should answer to other members of the team, what are their deeply held values? What do they really believe in? What principles do they adhere to? What ethical traditions do they embrace? How, in fact, when an issue is presented, whether that be an ethical dilemma, ethical temptation, or a locus of authority problem, how do they navigate through that? How do they think about their ethical decision-making? And so it really is a process of we're getting all the professionals together and sharing ideas and approaches to ethics, whether that be what values they embrace, what values they prioritize, how do they view ethics, what types of ethical traditions, whether that be consequentialism, deontology, an ethics of care, whatever it is, and that has to be unbundled anyway. Some of the individuals may not understand what that fully means. And how do they think about, how do they go through making ethical decisions? I mean, what are their steps? I mean, do they have to have certain conversations that they believe in? They need to fill in the gaps of the story. Do they need to try to classify ethical issues into different categories, whether that's an ethical dilemma or an ethical temptation where there's a clear right and wrong course of action, and then ask themselves, what is expected of me in this type of ethical situation? In an ethical dilemma, there really are two right courses of actions or two principles that conflict. So what's expected of me to make that is ethical judgment? In an ethical temptation, where there's a clear right course of action and a clear wrong course of action, what's expected of me? Well, moral courage, moral sensitivity. So I think it's that ability to carve out a moral commons where everybody on the team feels that they have a safe space to share and dialogue with other members without being criticized. And that information then can be processed within the team to come up with some, common compromise approach.
Yeah.
And so it's that idea of creating a moral commons that I think is extremely important.
Bruce,
the ability to convince people, individuals, through a process of intentionality of always bringing up issues through an ethical lens that is so important for ethical leadership.
Well, I think, Bruce, you've hit the head, and I think maybe what would resonate here with the group, for those who work in acute care space, let's talk about patient safety stories. We know that the AHRQ has asked that oftentimes that meetings start with patient safety stories, right? To connect back organizational purpose, right? Because that's what we're all here for, is for patients, and connecting that purpose back to who we are. And when we start with stories of patient safety, there's some good evidence that suggests people will be attuned to it. Right. I have worked with, John and Callie, again, I don't know this, but worked with other organizations and leaders across the country to say, well, is there a space or a way that could be analogous to moral commons? I think patient safety would probably, there's a way to make it resonate with healthcare leaders, which we could call, which we called when I created it, was sort of either mission moments or comments of sort of ethical reflection. And so we've done some work around getting leaders to give an example of an ethical issue they've confronted. How did they face it? What values did they bring to the table? And getting other leaders to have those conversations. So Bruce, I really, really appreciate that sort of feedback.
One other comment, to have a functioning interprofessional team and a shared space, one of the factors that inhibit that is when the culture of the organization really intrinsically embraces a hierarchical culture, where in fact the physician is viewed at the top, which is traditional, and other members are viewed below. And one other point I want to make, I teach residents, I've had the opportunity, and one of the things I noticed immediately with medical residents is they refer to anybody who's not a physician as middle-level professionals. And I ask them, how do you think a nurse, a physical therapist, an occupational therapist, a respiratory therapist would feel? How do you think they feel when they're referred to as middle-level professionalism? And what that gets at, the main point, is the power of language, right, and linguistic conceptions that can result in feelings of that there's not an equal footing.
It's a power imbalance.
There's a hierarchical level,
Correct.
which can inhibit ethical conversations.
Sure. So thanks, Bruce. I appreciate that. So group, I'm going to turn, and given our time, I'm going to turn to our last question. And Jesse, maybe sort of start with you, if you don't mind, to give you the mic back. So when I look forward, or let me say this, when you look forward and you think about those folks who are on the call, maybe 3 years, 5 years, healthcare changes every week, maybe every month, as all the leaders on this call know. I wonder what you might see are the ethical challenges that leaders in healthcare will be facing in the near future, but next 5 years.
Sure. So, granted, I'm still, relatively early in my career, and hopefully I'm wrong about this, but I think if the last, year and a half has shown us, I think it's going to be an ethical challenge is sort of establishing trust, both within an organization, trust by providers with their leaders and kind of the executive level, but then of course trust by patients and family members towards healthcare systems and healthcare institutions. I think with a lot of the misinformation out there and just even politicalization of healthcare in many respects, I think it's a matter of healthcare institutions are going to have to be working hard and going to be challenged to kind of establish trust and then maintain trust among their patients, among the population, and among their among staff members.
That's great. Yeah, no, Jesse, I couldn't agree more. I think trust has always been a key feature of healthcare, and is on the walls of many of our organizations as something that's core to us. A lot of us take surveys to assess trust amongst our teams, and ask our communities and patients that we serve whether they trust us or not. So I think it will continue and will heighten in the next few years. Carol, maybe if I could ask you the same question, and if you have the same answer, fantastic, but no worries, but be curious what you think are going to be, some of the key challenges that leaders are going to face.
Well, first of all, I think the real drive, because of our population growing older and older and more people needing the services of medical professionals, the drive to keep costs down really is causing a dilemma for all of us, because we strive for the best quality, and then we're also trying to keep costs down. Those two don't go hand in hand, and it's very hard to find a good balance and feel like you're doing what's best for the patient, but then also keeping hospitals thriving. So I think that's going to be something that we're all faced with. And then I have to throw in, Jason, palliative care is my background as well. Because of our aging population, futility or whatever you want to call it, I think end of life care is becoming more and more challenging. I would have thought by now, with 20 years in medical care, we would have fixed these problems, Jason, but obviously they're just getting harder. And I think that's going to be something that we are faced with, the moral distress of, when do you decide to use some of these life-saving resources, and when do you start having to, as a nation, deciding that this we may be doing more harm than good by trying to keep people alive. So I had to put that plug in there as well.
I knew you would, Carol. I know you too well. Well, appreciate that. And I think you're right. Georgia and other states, I think it's not a Georgia problem. It's a national problem. It's probably an international problem about how are we going to provide care that is clinically appropriate in all settings, given the population and the resources that we have available to, and it will be a struggle. There's no doubt about it. And I think, leaders on this call like Trent and folks who are even leading smaller hospitals, larger hospitals, even units and divisions will struggle with this. And then, to your point, we'll have the emotional turmoil that falls out from the result of that. And that will be a challenge that healthcare leaders will have to face, right? That are on this call about the struggles that their team members may face as a result of potentially inappropriate, non-beneficial, futile interventions, whatever we want to call it, and the toil that takes on them in the long term. So appreciate your insight. Bruce, maybe you'll give us a quick insight into what you think the challenges might be going forward. We have a couple minutes left, and then I want to give some final remarks, and we'll go from there.
Well, there's so many, so I just picked one, and it's the ethics of integrating emerging technologies into healthcare. We're going through a digital transformation now, where, for example, artificial intelligence that focus on machine learning algorithms are being integrated more and more into healthcare. And that raises several issues. For example, how do we maintain the human dimension of care when more and more we're using algorithms to decide risk assessment, prediction models, and treatment pathways? We're also going through changing payment models, focusing on value-based payment, which leads us to understanding the ethics of population-based health, data informatics, data collection, labeling data, and controlling for bias. With value-based care, we're concerned about interoperability, allocation of resourcing, resources, that's going to be important. But it's really how ethically now we deal with, ethical leaders deal with really this changing landscape in healthcare towards a technologically driven healthcare system that's relying more and more on technology to make clinical decisions. And where then does judgment fit in? Where does the human in the loop system fit in? So if we're having machine learning algorithms predicting risk or creating models of treatment pathways. As a matter of fact, there was an article that just came out where some are trying to use machine learning algorithms to predict whether or not someone would really want extraordinary care at end of life. And it's just an interesting article, which would then subordinate circuit decision making to a different level. So I think it's those kinds of issues, and whether or not healthcare professionals are educated to understand how to use some of these technologies that are going to propose or present very important ethical issues in the next 10 or 15 years.
Yep. Well, thank you, Bruce. I'm going to round out and give you my 2 cents. Whether you all want it or not, I'm the moderator. I get to do that. So I'm going to step back and say, I think the biggest probably ethical challenge faced by leaders going forward is simply being an ethical leader. That is probably going to be the largest challenge they will face because, as Massey says in the chat here, there are lots of situations that are happening around our healthcare arena, and it can be in hiring, it can be in marketing, it can be in the compliance, it can be in law, it can be in anything, pop out. It doesn't matter what space you work in, ambulance, device, vendor, either, whatever it is, there are all these internal and external influences that are happening on leaders to either perform, right, or to act, and they create struggles. So, Massey points out, I believe, this example of enticing team members to come work for you. So you offer a $5,000 gift card to Amazon if you're going to come work for our organization, and that may be good. It's a bonus. It's an incentive program, but I think we often don't think about things from that lens or that perspective about what would an ethical leader do? What does it mean to be an ethical leader in this space, and to think through all of the challenges that leaders are going to face on a daily basis. The reason I think being an ethical leader is probably going to be top is because we're asking leaders in healthcare to be everything. And that's tough. We're asking you to be sort of many lawyers. We're asking you to be many compliance officers, many patient safety officers, many clinicians, many administrators, many everything. You have all these hats that you're supposed to be wearing, and which one gets priority is oftentimes the result of the tension that you're facing in the moment. And we often say we want to be ethical leaders, but when we get pushed and tensions happen, what we know is that we don't end up like that. So we don't focus on the ethical sort of components of a situation that's confronting us. And so I think that's going to, for me, from Jason's perspective, going to be the largest thing going forward. So we're going to stop right here, and with questions for the group at least. I want to take time to thank Carol, Jesse, and Bruce for joining me up on this virtual stage together. I really, really do appreciate all your comments, your feedback, your sort of participation. I think made for a great conversation today, and sort of turn it over to the audience, to you, to the larger group who may have questions that you want to ask this group or want to think through together. We'd be willing to definitely do that. Please, I will say, if you're going to ask things, don't put things in about particular patients. We don't need any PHI violations in the midst of a GAHE talk, but I'd be curious maybe to the group about, Massey points this out, what ethical leadership challenges do you all think you're going to experience? And so I'd be curious from the group, please, as Bruce L. said, put your questions in the chat. love to hear from you. And thank you again, panelists. Thank you very much.
Yeah, thank you. Hey, Jason, I just want to follow up with my question.
Yeah, Massey.
Massey Arrington, sorry, I know it says Thomas, everybody calls me Massey. So I'm just seeing crazy. And back to your point about all of us wearing different hats, it's, from a clinical perspective, especially as I've been trying to help with respiratory, where we have, ridiculous numbers of open positions and we're competing with other hospitals. And there's crazy things going on. And you've got the hat of, well, I can't go create a GoFundMe and legally entice you with a payment that doesn't get reported to the IRS to try to get you to come work for me. I have to stay focused on what I can do legally. And not all of my competitors are doing that. And at the same time, I have the hat of, gosh, I really need to provide patient care and keep these RTs on the COVID unit and keep my sleep centers open. And you get this gray area, and it is challenging to stay focused as an ethical leader. And there are times when you have to say, I'm sorry, doctor, I can't give you an extra incentive for every patient you send to my sleep program. You have to be able to, those are usually very clear. But where I'm seeing the grayness has to do with all this hiring. So it was just a question to see if anybody else, because I know nobody talked about that, but I'm very clinically focused. And I think it's going to be a challenge. And you're balancing growth demands, budget demands with what can I do without breaking any ethical rules? Some of the stuff that's taken place, it doesn't pass that gut check. That's all. Thank you.
So Massey, great to see you. Thanks for popping on. And I think I'll turn to the panelists, but I'll say one quick thing. I think Massey, and maybe we'll get to a question. I have some others that I can pose to the group, but there are definitely sort of like legal thresholds that are problem, right? That everybody should be playing, we're supposed to be playing fair games with each other. And then there's this other side of things that I think is a distinct side of things, which is what should we be doing? And I think that's the struggle. I think that's a struggle as an ethical leader that you're facing, is that you're confronting this should self of trying to come out and say, yeah, but I know I shouldn't do that, right? I understand all the hats I'm supposed to wear, but I'm struggling with the should self because I have something internal. What I will ultimately say is, and I say this to every leadership development or training I've ever done on this topic, is you have to stand for something, right? You have to stand for something. And what you will stand for are your values, right? Whatever those may be, right? And so that's my sense. Like you have to play the game by the fair rules that we know are being played, and then stand for something. That's sort of what I think an ethical leader. But I'd be curious, Carol or Bruce or Jesse, if you have other thoughts or in that space.
No, I definitely agree with you, Jason. And I sometimes standing with your values is the hardest thing to do. Having an ethical and moral compass sometimes does make it a little bit more challenging. And I think you, just like Jason said, you have to do what you feel is necessary to keep your business going, but then you've got to be able to go home at night and sleep and know that you can lay your head on that pillow. That's something my father taught me a long time ago. One suggestion, and I don't know if it's even possible in your world, but I think that where we're losing as a society is that we're not thinking about we're being very self-centered right now within our organizations. And at some point, some of us that have the moral values need to try to pull people together and say, hey, this is a problem for all of us. So how do we do this? How do we make this work where we do not have one area of town or one part of Georgia or one state that is struggling the most? That's a very hard conversation to have and hard to pull people together and then try to push your values on them. But at least you go home feeling like you've tried. That's kind of my point.
Carol, if I could piggy that back into another question that was asked, and Bruce, maybe we'll turn this over to you for a quick response. So it's about personal values. That the audience is asking, do you see more overlap of personal dilemmas, right? Of an individual dilemma, sort of being, I think what they mean is a balance of personal life, not just their moral life, right? So my personal values coming in, I'm going to pick on Massey. We know each other, so Massey, I can do that. It's okay. But, you know, Massey believes it's okay to go out and injure kittens all around Atlanta, and he does that in the evening, you know, and that's his personal thing. And then he comes to work and they're like, well, Massey, you can't do that here at work. You know, what do you think, Bruce? Do you think these are there going to be, is there more overlap of these personal dilemmas? Is that where they come from? Or do you think it's overlap between organization, personal? What do you see it as?
Yeah, you know, when I talk about ethics to students and others, I talk about categories of ethics, or morality, really. Morality is different. Morality deals with values. It's just what we believe in, where ethics is more of a process of analyzing our morality. But we have personal values and professional values. And so they often conflict, where we believe in something, but our professional values embodied in documents like codes of ethics and core value documents are different. So where does our obligation lie? And I strongly believe when we accept being a professional, that our profession's values should trump our personal values, unless there's really some important exemption. You know, and there's been incidences where, you know, I've been told stories where a nurse, for example, a female nurse, was very conflicted in helping and treating and caring for a patient who was a pedophile. And this nurse had several children, and from her personal value standpoint, she didn't want to treat this individual, but from a professional value standpoint, she had an obligation to treat individual regardless of their background with dignity. So I think that's a very difficult situation. It gets into abortion also. You know,
Bruce, if I could pause you right there. So let me add on to that because what you said just got asked in the question. So let me add this, what you were just talking about, this situation between personal values, right, and professional values. And one time where this comes up frequently, and Jesse, I'm going to turn to you about your general sense about this, is the dreaded, well, folks will say it's dreaded, let me just say that, the situation about mandated vaccines and what we do with mandated flu vaccines, and how to think through these conversations, or think through the ethics of being an ethical leader in vaccine mandates. And so, Jesse, I'd be curious, you know, not necessarily, you know, what you've seen from Wellstar's stance, but what you think as an ethicist and knowing ethics, you know, your thoughts on vaccine, you know, how to navigate vaccine mandate conversations from an ethical standpoint.
Yeah, so I think it's a really obviously topical question, certainly a challenging one. You know, I think as healthcare providers and folks who choose to kind of go into this field as a profession, obviously there are different medical different organizations have different you know, codes of practice and ethical codes, and you know, could you argue that part of that obligation of being a provider is kind of ensuring a safe environment for patients and doing what you can to kind of protect your patients, as part of colleagues, as part of a bigger system, do things to protect your colleagues, and basically protect those most vulnerable who maybe otherwise wouldn't be able to get vaccinated, for example. And so thinking through that as sort of you know, as part of a bigger community, as part of a medical community or nurse community, or just a healthcare community in general, I think there is a strong ethical argument for vaccine mandates in healthcare institutions. You know, unless if there's a religious, you know, reason or a very strong kind of conscientious reason, perhaps that could be considered. But I think that the default is that should be ethically support, or it is ethically supportable to mandate vaccines in times of a public health crisis.
Yeah, Carol or Bruce, feel free if you want to wade into the water of vaccine mandates. I will leave it to you if you want to.
I would love it.
Carol,
at Emory,
yeah.
At Emory now, all Emory healthcare employees have to have a vaccine. In some other healthcare systems, I think Northside, for example, that's not the case. I'll just refer to the APTA Code of Ethics, or the PT Code of Ethics in the state of Georgia, State Practice Act. In the preamble, it makes very clear that the obligation of physical therapists is to protect the public welfare. I mean, that's the bottom line. And, not cause harm. And from my perspective, a healthcare professional who works with patients or other healthcare colleagues who refuses to get a vaccine is violating that obligation to protect the public welfare. So I very strongly feel that any individual healthcare professional who works with patients in a healthcare environment is obligated to receive a vaccine, despite their personal preferences. Now, I understand the fact that some really have, concerns, and I don't want to minimize concerns about long-term effects, but that's always been the case in history. If we go back to the polio vaccine by Jonas Salk, when that vaccine was starting to be applied, many individuals who got the vaccine developed polio and some died. So there's always been a risk in doing some innovative or applying some innovative technique. And by the way, a new book just came out by Paul Offit, and it's called You Bet Your Life. And it talks about the fact that any type of new healthcare approach, whether it be blood transfusions, mass vaccinations, use of X-ray, or anything, has always contained a risk. You can't avoid it.
Yeah, I mean, Bruce, you're right. There's a balancing of benefits in all healthcare is a balance and benefit situation. So Carol, if you'll pause for me just 1 second, I'll get you. Catherine, you came on screen. I saw you. I didn't know if you wanted to ask something, if you want to put it in the chat or you want to come back on video. Feel free. I saw you and want to just recognize you. Is there something you wanted to say, Catherine?
I just wanted to highlight, so I actually know Bruce quite well, and I'm a PT by background, and I work at Emory, so it affects me in multiple, but I don't work as a PT. I think one of the things kind of that you guys are talking about, whether it be vaccine or flu, flu is one of those things some can rally around, and I think as has been highlighted, many of our organizations who've put this in, we've put the caveat, you can have a medical exemption, you can have a religious exemption. So it's not an all or none. So I want to be very clear that even though there's the kind of the mandates in place, there are those caveats to acknowledge. And we even have a pregnancy deferral. So some people are saying, hey, I don't want to get it while I'm pregnant, but hey, as soon as I'm done with my pregnancy, I'm happy to go get that. So I wanted to make sure that people have that nuance, because that is a little bit of a you can be very political about it.
No, I agree. So Carol, if I want to give you the last minute we have, and then I'll just want to say one closing thing, and then I have to turn it over to you. Technically have 2.5 minutes, but I was saying a minute to give you enough time. So Carol, feel free to chime in on the vaccine question.
Yeah, I'll talk real fast.
Sure.
And I know this is not a debate, and since we only have a tiny bit of time, I'll give Bruce a chance to respond. But when you say when Bruce says that your moral or your values kind of have to come secondary to your profession, in some ways I don't always agree with that. I think we all have to make our own personal decisions, and I had an employee who flat out did not want to get the vaccine and we had a wonderful talk about it, and I respect her opinion, and she knows that this could affect her being a nurse going forward, but she felt that strong about it. And I do think there are times that I've been morally challenged where I actually left a really, really high paid job that I decided I could not do what was asked of me. So I do think that we always have that opportunity, and it is a choice.
Yeah, and I think, Carol, that's a great segue to my last minute and a half to give it back to Trent here in just 1 second, is to say, you know, this is, to Carol, you pointed it out. It's tough to be an ethical leader, that we have to stand up and think about what our own personal values are, and then what we're being asked of as a moral manager, so that we can sort of fill in that shoes, as I would say, to be an ethical leader. And these challenges are around us. COVID is one big challenge, but there's more, right? There's recruitment, there's everything, as Massey, all of the folks on this conversation have pointed out. These challenges are part of being a leader. And I think that that's why we need to emphasize regularly and think through, as organizations across Georgia and beyond, what are we doing that will help our leaders become stronger ethical leaders? What are we doing to engage them, to cultivate them, and to bring them sort of around to the point where should they confront an ethical situation, they're empowered to do it, they have a process to think through it, or they know how to go to a resource that's available to them to think through it and come to resolve. So again, I'm going to thank Carol, Bruce, and Jesse for all the time and opportunity today. Thank you, GAHE. Thanks for all the participants. And Trent, this microphone's coming back to you. Thank you very much.
Hey, thanks, Jason. Appreciate it. What a great discussion. Really thought-provoking. Certainly a lot of the challenges and dilemmas that we've been dealing with on a daily basis, and especially over these past 22 months. So thank you for all of your expertise and engaging this group today. Just really, really great dialogue. And thank you for the work you're doing too, because you are frontline helping our caregivers to make really difficult decisions in today's environment. So we really appreciate your insights. Want to take a moment to not just thank Jason and the panelists for your time and insights, but also want to really thank those that helped to put this on today. In that group, Victoria Doon-Chari, Gina Tipton, Sebby Browning, and Angela Henry, really instrumental in helping us to put together this event today as part of our programs committee. So thanks, team. Also want to thank everyone that's out there today online with us. Thank you for your leadership. It is a daily battle, no doubt, and you're out there in the trenches every day, helping us to provide the best possible care to the great state of Georgia. So thank you all for your participation today, and certainly what you do every day. Thanks for ACHE. They help us to put on events like this, and certainly truly appreciate Vishwa and her team for all they do. And last housekeeping item is that you'll receive an evaluation. We really want that feedback so we can get better as we move forward in events like this. And so please give us your feedback, the good, the bad. Hopefully there's not any ugly, but certainly want to get that feedback from you. And with that said, again, thanks for all involved today. And thank you for allowing me the privilege and honor of serving as your GAHE president these past 2 years. And I know going forward, you're going to be in great hands with John and the rest of the folks that were nominated and accepted into their roles for 2022. So thanks so much. And Vishwa, take it away.
Thank you. So on behalf of ACHE, I want to thank everyone that planned today's session and all of you for your participation. Like Trent said, please complete the evaluation. The link is in the chat and it will be open for 1 week. You can also access it by visiting your My ACHE page and selecting My Online Learning from the helpful link section. And that's the same location where you'll be able to access this recording within approximately 2 business days. For everyone who attended today's event in its entirety, you'll see your 1.5 hours of credit posted to your My ACHE account within 2 weeks in the My Education Credit section. That concludes our session, which is copyrighted by 2021 by the American College of Healthcare Executives, all rights reserved. Thank you everyone again, and have a great rest of your day as well as the weekend.
Thanks.
Thanks, guys.